There we go. So we're definitely recording it now. So I'm going to go ahead and get started. I'm going to share my screen. So can everyone see my screen?
We can.
Awesome. So everyone's going to receive their email from Employee Navigator. It's also going to show the Alliance CAS logo on there, so you know it's coming from us. On this, you're going to be able to log in either with your login from last year. If you need any help, you can reach out to our team, and we're here to help you through it. We were trying to get everybody enrolled as quickly as possible. When you go ahead and log on, your screen's going to look like this, and it's going to allow you to start your enrollment. We've pre-populated most of the information. We've had it from last year, so you'll be able to see what you had and comparing it to what you're going to have. And again, any questions that you have, you can reach out to our team. In here, you're going to have the documents library that you're going to be able to access throughout the entire year. It's going to have the benefits booklet that I'm going to be going through today, and the full summary of benefits, all of the products that you have available to you in case you have specific questions, because we're going to go through an overview today. And of course, you can reach out to us as well. So everyone's going to have access to their employee benefits booklet. It's going to look like this. And this is our team. So here's Jessica. I'm sure many of you are familiar with her. And again, I'm so sorry she got caught on a late flight and didn't make it in time. So this is our team. We are here to help you in any way we can regarding any insurance questions that you have. So we have a full service team that you can email, call, go on our website to have a service request. Service requests we answer same day or no more than 24 hours. But if you're at the doctor and you forgot your ID card, you can reach out to us. We can text it to you. We can email it to you. If you have a claim, maybe you received in the mail an invoice from your doctor for a medical procedure that you recently had done, and you're not sure if you have to pay for it, or if it's a gap claim, and we can help you with that right through the claims website, the claims email, or again, you can reach out to us and we can kind of talk through it if you have any questions. We also have our enrollments team. So if you don't get the link after our call today, please let us know and we'll send you the link again, or we'll help you troubleshoot it. Or if you're having issues along the way when you're enrolling, go ahead and reach out to the enrollment team or myself. So I'm here all day today if you have any specific questions, then you can go ahead and reach out. Here's our number. I'm sorry. Here's our phone number. And our office hours are open Monday through Friday. This is going to be effective December 1st. That's your open enrollment. So we're trying to get all this done as early as possible so that we have cards and everything prior to December 1st. And then we're going to talk about the benefits. So you guys are going to be with Aetna this year. We have, if you have any questions on providers or medications, again, you can contact us or you can reach out on the Aetna website right here. You can even just click on it when you're on. It's going to direct you if you need to look up any doctors. We're going to have two plans that you're going to be offered today. You're going to have a national HMO, which is called an EPO. So your Aetna is a national carrier. You're going to have access to doctors, hospitals throughout the United States. They have a huge network. And then you're going to have a POS, which is just going to give you out-of-network benefits. So if you see a doctor or you want to see a doctor, have a procedure with a doctor, it doesn't accept any insurance or it doesn't accept Aetna for that matter, you're going to be able to have access to that, but you're going to have a separate deductible, a higher deductible, and a higher out-of-pocket. So I'm going to be focusing on the EPO, which is what would be my recommendation, because the EPO and the PPO are identical. You're going to see that everything is going to be the same, and the only difference is going to be the out-of-network benefits. We'll get into that at the very end. And then we're going to have GAP again this year. The GAP's going to be for $5,500, which is going to cover your entire deductible and $500 in some co-payments, for example, in the ER that you may need. So when you combine these two plans together, you have a platinum plan with a zero deductible. So what I'm going to go ahead and do is I'm going to focus on the GAP towards the end. I'm going to first go ahead and go through all of the Aetna benefits first. So your Aetna EPO has a primary care physician co-payment of $35 and a specialist co-payment of $75. It is an open access plan. You do not need referrals. If you need to go straight to a cardiologist, you can go ahead and make that appointment. Anything preventative is covered at 100%. So your annual visit at your doctor, if you're a woman, your gynecologist visit, your mammogram if you're over the age of 40, and your colonoscopy if you're over the age of 50 is covered at 100% at no expense to you. Then you have access to virtual visits. I think after COVID, we all got really comfortable being on a camera. So you're basically doing the same thing we're doing today. You would FaceTime with your doctor. It's a $35 copayment. We use Teledoc for that. And if you're not feeling well, you can go through a list of what you're feeling. They can send you antibiotics or creams straight to the pharmacy. I have kids. I use it for my kids as well. And they also have mental health providers on there. So if you're not feeling 100%, there's things that you're going through and you want to do a virtual visit, you can. What we highly recommend are clinics. So CVS and Aetna, they own each other. So there's going to be a lot of discounts at CVS. So if you go to a Minute Clinic, so the clinics inside CVS, it's free. So you have them in Target, for example, and you have them in most CVS's. You can see a nurse practitioner or a doctor at no cost. They can test you for COVID, for the flu, for strep. If you have a cold, they'll send the medication right to the pharmacy. If you prefer to go to Walgreens, they have them at Walgreens as well. Walgreens will be like seeing your primary. It'll be a third. Next line of defense is urgent care. You can go to any urgent care you want. So you can go to the Baptist, the MD Nows, the Nicholas. That's going to be a 75.
Can you put everybody on mute, please? Somebody has their speaker on. So it's getting feedback.
I think I'm echoing too, though. I'm not sure why, too. I was trying to play with it. So, oops, sorry. Let me see who's. It seems to be my echo, so
Are you on two different devices?
No, I'm not. It happened to me the other day, too. Now it's cutting in and out, so I think we're okay now. Now, everything else that I'm going to talk about, emergency room, diagnostics, and hospitalization, that's all going to apply towards your one-time annual deductible of $5,000. And then after that, it's going to be covered 100% except for the emergency room. So if you're going in through the emergency room and you have that deductible, you're going to be responsible for a $5,000 deductible and a $300 copay. So your emergency room is going to be $5,300. Now, I know that number sounds high. We have the gap. The gap's going to cover up to $5,500, meaning that your ER visit, when you combine it with the gap, is going to be free because it's $5,300 and you have $5,500 in gap insurance. So just really important when you're going through an ER, when you're going to an urgent care or a hospital, that you show both your ID cards, that you never front the money. If by any chance you left your card at home and you had to pay for something, please send it to us and our office will process a reimbursement through the gap for you. So the gap is going to cover up to $5,500 for that emergency room. It's also going to cover your labs and x-rays, which are your minor diagnostics. And that's also a very low fee. Typically labs are less than $50. And if you use the gap, you're going to be $0. So major diagnostics, again, the first $5,000 are your responsibility. However, with the gap, an MRI will cost you nothing. And outpatient surgeries and inpatient surgeries are also subject to $5,000. Again, with the gap, you pay nothing. So when you combine the two together, you're not paying for an urgent care. So that $75 copayment, you can use it and it will cover it completely. You're not going to be paying for an ER, labs, major diagnostics, or hospitalizations. So really important to combine the two. There's no co-insurance. So a lot of plans have 20% that you have to pay after. That's not the case with this plan. Once you've met the $5,000, the only thing that you have is a co-payment in the ER or your office visits or your prescriptions after that, but there's no 20%, no 30%. So it's a pretty easy plan, pretty cookie cutter when you're going to use it at the hospital. Now, Do you guys have any questions on hospitalizations, outpatient surgeries, or MRIs? I know sometimes it can be confusing. I know you've had the gap in the past. Have you guys have any issues with the gap or any questions with the gap? No? Okay, so just
Well, I was just gonna say, like, I've had problems where they, like, my doctor's offices just don't charge to the secondary, like, insurance. So what is your suggestion on when they say, oh, well, we have this down, but you still owe blah, blah, blah money?
absolutely. So where we sell this, and it's been around for 10 years, but we ourselves have issues in two places. And it's not necessarily a gap issue, it's more of a provider issue that we have. So we experience the same thing. The gap is going to give you up to $5,500 for in-office procedures. So it has to be a surgical procedure like a biopsy or an ultrasound that will be covered in the doctor's office. However, the co-payments, the 35 and 75 are not going to be reimbursed. You're still going to be responsible for that. But let's say that you had a biopsy and that biopsy was $200. The gap will cover that $200. However, like you mentioned, a lot of providers will only bill one policy and they just don't want to bill the gap. If that's the case, if you paid there, please ask them for an itemized invoice so it can break down the cost. With your receipt, email that to our claims department. We'll send it into the gap. It takes, about 30 days, sometimes less than that, but it takes about 30 days depending on if we have everything that we need, and then they'll send you a check to your home. What I usually recommend and what I do is I kind of just wait. And if I know I'm going to be doing some stuff in the doctor's office, I usually will wait and I'll do like 2 or 3 together. And then I send the 2 to 3 to the gap for reimbursement and kind of get like a bulk reimbursement. So that will also help our office too. So if you have maybe, one that was $50 and then one that was $200 and a third one, just send us all of them with the itemized invoice and a copy of the EOB, and we'll send it and they'll mail you a check. So what we need is an itemized invoice and a copy of the explanation of benefits. So every time you go to the doctor, you have any procedure, the insurance company will mail you what's called an explanation of benefits to your home. And it'll say, hey, you went to this doctor, the doctor billed us $50, we paid him $50 and your exposure is X. And if they applied anything to your deductible, then that's everything that you're gonna get back. So you can send us that. We can also sometimes, if you didn't get that EOB, we can go ahead and request it for you from Aetna. And that way we can help you process that claim. The only other place that we have issues with the gap, and again, it's not the gap, it's the provider, is for labs. So a lot of the times, as we've actually reached out to Quest, we've even got the most common facilities nearby and have taken it all the way up and have told them, please, like everybody has gap. This is something that's on like 98% of groups. And unfortunately, they were just, even if you provide it or you put it online, they were still not billing it. So what we did is we reached out to Transamerica and we told them kind of the issues that we were having. And for lab work, they're allowing us twice a month. We send a spreadsheet out with all of the labs for our clients, and they're just reimbursing it and they're not requiring the EOB and as many things as we would normally need. So for labs, that's kind of our workaround. So if you had a lab done, just send us that invoice. We'll put it on and it will take, 2 to 4 weeks to get that reimbursement done. Because I know that you're going to have issues at Quest and you're going to have issues at your specialist, unfortunately. For everything else, you shouldn't be having those issues. So at urgent care, ERs, hospitals, they know gap, they bill gap. You shouldn't have any issues there. If you ever do, please call us while you're there. We're happy to speak to the hospital. We're happy to speak to the urgent care and make sure that you're not fronting that money. Okay. So the gap, $5,500 for surgical procedures in the doctor's office. It will cover the $75 in the urgent care. And then it's going to cover anything that the deductible applies to. So ER, diagnostics, and hospitalizations. What does the gap not cover? The gap does not cover your office visits of 35 and 75. It does not cover prescription drugs. And it does not cover therapies. So for example, if you're doing physical therapy, it's going to be a co-payment. It's not going to cover physical therapy. But for everything else, you're good to go. So does anyone have any questions before I jump into prescriptions? No? Okay, so prescriptions, we have a 4-tier drug card. Generics are gonna either be $3 or $10. Okay, just depending on how the drug is tiered. If it's a tier 3, which is a preferred brand drug, it's $50. Non-preferred drugs are $80. And then specialty drugs. So specialty drugs are really high cost drugs, infusions, injectables. You're going to pay 20% of the drug up to $250 or 40% of the drug up to $500. Really important. If you're taking any drug over $50, please call our office. I would probably say 9 out of 10 times there's a manufacturing coupon available or a copay assistance program on these drugs. So the manufacturers want you to take them. So there's a lot of assistance on those. And then there's always GoodRx. So what we'll do is if you're telling me, hey, I'm paying $250 for a medication, what we'll do is we'll look it up. And if there's a program for you, a lot of the times there is, and it'll leave that drug at almost nothing. Sometimes it's free, sometimes it's $10. So a lot of people take Repatha, and Repatha is like $500 a month. And Repatha, there's a program that leaves the copayment at $10. So just any issues that you're having with high cost drugs, please call us if you're paying that high copayment, and we'll try to see if there's any way we can help you. So like I mentioned, the EPO and the PPO that you see here, they're identical if you're in network. The only difference between the two plans is that on the POS, you have out of network benefits. So what does that mean? That means that you want to see a doctor or have a procedure and that provider does not accept Aetna. If you go there, you're subject to meet your deductible first, and your out of network deductible is $10,000. After you've met $10,000, Aetna starts to pay 50% of the claim, and you're responsible for the other 50% until you reach your out of pocket of $25,000. So in reality, until you reach $25,000, the insurance is not paying 100% of those claims. So this is really for a big surgery, catastrophic. If you're going to just see a doctor one time out of network, to be honest with you, that doctor's probably going to charge you $300. You're going to end up paying for it. It's going to apply to the deductible. But if you're having a major surgery and you want to see an out of network doctor, you're going to be responsible for $10,000, then 50% until you reach $25,000. Let us know if you're seeing an out-of-network doctor. We'll go through kind of what that looks like, what your estimated costs could be. The doctor will also tell you too. Some doctors will bill the insurance, some doctors won't. It really depends. Unfortunately, because that doctor does not have a contract with the insurance company, in essence, they can do whatever they want. They can charge whatever they want. So the insurance is always going to pay as if you were in network, or what the usual and customary rate would be for that procedure in network, but that doctor can balance bill you. So I really highly recommend that you just stick with the EPO since it's national anyway, and there's so many Aetna providers throughout the United States, like MD Anderson is in network. Because even if you choose the POS, it's a little bit of a higher cost, and the out of network costs are so high that people don't use it. So you're good with the HMO because it is a national HMO. That with the gap is my recommendation to everyone. But if anyone has any questions on the POS plan, just let me know. No? Okay, so I'm gonna go ahead and move to the dental and the vision. The dental and the vision is with United Healthcare. This plan with United Healthcare is unlimited and it is a PPO. So with a PPO, you can go to any dentist you want, whether they accept insurance or they don't. So if you love your dentist, and I know a relationship with a dentist is one of those that if you like it, you typically don't want to change it. So you can go to any dentist you want. However, we do recommend that you stay in network, and that's kind of for the same reason as the medical. If you go out of network, the policy will still pay. However, they will pay as if you were in network, and if there's a difference, the dentist could charge because they don't have a contract and they can charge whatever they want. But it still will pay a percentage of that dental work, and you're still going to be getting that coverage. So if you're doing anything diagnostic, which is your cleanings, your biting x-rays, and your exams, it's going to cover 100%. And you get 4 cleanings a year, which is great because a lot of the times we need deep cleanings. And now if you're going every quarter, you might not have to do that deep cleaning, so you get 4 cleanings per year. It's gonna cover 80% of anything basic. So that's simple extractions, emergencies, cavities, simple, for example, gum disease, which is perio and endo. It's gonna cover 80% of that. You're responsible for 20% of the claim. And then it's gonna cover 50% of anything major, which are dentures, root canals, and it's gonna cover implants. So us being in Florida and I'm Latin, a lot of the times we want implants. So if you don't have that tooth or you've been wanting an implant, you can go ahead and do it. There's no waiting period on this plan. So even if you weren't on it and you're gonna get on it now as of December 1st, you can start that process for the implant. So you will have implant coverage. It will cover 50%. We actually offer this same plan to our employees. My husband did 2. And it really helped because we basically got 2 for the price of 1, because implants are like $3,000. So you do have the implant coverage. The plan is unlimited. Most dental plans are capped out at $1,500, and after that, it's on you, the remainder of that bill. For us, there's no max. So even if you needed $10,000 worth of work done, it's gonna pay a percentage of that dental work with no limits. Again, no waiting period. You do have a $50 deductible for basic and major services, and it's going to give you $1,000 toward braces. And this is nice because it's $1,000 for adults and children. So if you maybe needed the implant or you had a root canal done and you need to fix your bite now, you as an adult can get the braces, and it's going to give you $1,000. United works with Smile Direct. I don't know if you've heard of it. Smile Direct is like Invisalign, but where you don't see a dentist. So you go initially to, they have a lot of little centers. You go to the center, they do an evaluation with a dentist. They take all of the tray implants done, and then they go mailing you the Invisalign. And it's like half the cost. It's like it used to be $1,800. I think it's $2,000 now because they have a special deal with United. So if you've been wanting to get braces and you want to try to keep the cost as low as possible, take a look at the Smile Direct. Because it'll probably cover like half of it, because I believe it's $2,000 and the insurance gives you $1,000. Do you have any questions on the dental? No? All right, the vision. The vision is also through United Healthcare. You're gonna get 1 exam per year for glasses or contacts, so one or the other. Prescriptions are always good for 2 years, so I wear glasses and contacts. So what I do is I do 1 year glasses, 1 year contacts to kind of get the most out of the plan. Your exam every year is going to be $10. And if you like your glasses and you just want to pay the material fee, it's a $10 material fee. And then it's going to give you $130 toward frames every year and $125 toward contact lenses every year. So you can get glasses or contacts every single year. And then just depending on what you get is the allowance that they're going to give you. I always recommend the vision's so inexpensive too. Even if you have dependents that don't wear glasses or contacts, you can get this, and they can at least get their eyes checked every year. You can also use the frame allowance for frames with the blue lens, since we're always on our iPads and our computers. And you can also use it towards sunglasses. So if you don't really use the policy and you have the policy, get a pair of Ray-Bans, which are like $170, and it'll give you $130, and you'll get a pair of like designer glasses for a fraction of the cost. So just make sure you're using it. They also use Warby Parker. I think in Midtown, they have a Warby Parker, and Warby Parker is also an online provider for glasses. So you can get glasses through Warby Parker as well. Does anybody have any questions on the vision? No? I do want to make a note, United's going green and they're not giving dental or vision cards. So you're not going to receive a dental or vision ID card. Just be aware of that. We get a lot of calls like, hey, I need to go to my dentist. I don't have a card. You can just give your dentist that you have United, and you can give them your social and they'll find you. Or I suggest you download the app, and I'm going to go through all the downloads that I'm going to want you to do. And on that app, you're going to be able to access a digital copy of your card. But I do want to let you know, because we do get a lot of calls about that. And unfortunately, they stopped sending out ID cards like 2 years ago. So you will not receive a new dental and vision card. The Alliance covers 100% of your group life, which is a great benefit. It's gonna have $25,000 as a death benefit. So if something were to happen to you, it's really important that as you go enrolling in the benefits, we will need an updated beneficiary on everyone. We want to make sure if God forbid something happens, where that money will go to. So it is going to ask you for a beneficiary. That beneficiary needs to be over the age of 18, because if you put a minor, the minor will not get the money. They will not pay anyone under the age of 18, and it goes through probate. So please make sure that you do that. And let's see.
Alliance doesn't just cover 100% of their life insurance. We
It
cover
covers 100% of
everything.
everything, which is huge. So I've been in the industry for 20 years, and I always like to mention this. The norm is 50%. We see 75. We never see 100%. 100% is huge. And a lot of the times, since it's not something tangible that we can see, sometimes we lose sight of what that cost is. And that is a very big cost that the company takes on. And sometimes it's $5, $6 an hour more to your pay that you're not really seeing that they're paying out. So that is a huge benefit that I wanted to touch on, and just my experience, and let you guys know that you have a great employer and that most do not do this. So definitely now also take advantage of, like I mentioned to you, some of those little things on the vision plan. If you're not using glasses, get your sunglasses, use it because your employer is paying for it. We want to make sure that you take full advantage of it. So again, when you pair all these plans together, you guys have a platinum plan at no cost to you. Everything that you're going to see here is going to be on the online portal. When you go to elect your benefits, you're going to see all the costs if you want to add your dependents. So you'll be able to see that then. So now I want to talk about a couple of resources and apps that we want you to download. So we want you to download the N app, and that way on the N app, you're able to see your ID cards. You're able to see any claims that maybe you did. Like if, let's say we needed to file a gap claim for you, we would be able to see that explanation of benefits right on that app. So really important that you guys download that. We also want you to download Teledoc, and it's going to look just like this. And that's where you're going to FaceTime with the doctor. And again, I highly recommend it because I don't know about you guys, but there's been something that just keeps going around, and at least my kids have been nonstop sick. And we've been to urgent care, and sometimes you just get to the point that you don't want to go to urgent care the second time, and you can kind of tell them what you're going through, and they'll send you, a steroid or an antibiotic to your home. So definitely download Teledoc. You're also going to have access to an employee assistance program. You're going to have access 24/7 that you can call this number if you're having issues managing your work-life balance, stress. If you're going through a divorce, or you're having some legal concerns, they can help guide you. And again, that's at no charge to you. Employee Navigator, this is what you're going to receive, and I'm going to quickly walk you through it at the very end so you can see how to enroll. You can also just click this link here and put the company identifier code. If you don't want to wait for that email, you can click there. And then you're going to be able to see all of your information. So this is going to be accessible to you. Some wellness programs. So like I mentioned before, Aetna owns CVS. They're one and the same. So they actually have an over-the-counter program that gives you $25 to spend every quarter. So you get $100 a year, which is great, that you can use on CVS brand items. So like if you wanted your generic Tylenol, or you wanted generic wipes or alcohol, or whatever the case may be, you can go and get Band-Aids and cough medicines and anything. As long as it's CVS brand, you can use it. I'm going to show you in the portal, there's kind of a flyer, and you'll mention it when you go to CVS and you show them your Aetna card, and they'll sign you up. So it's $25 every quarter. Take advantage, because at least, medications gotten so expensive. At least you can get some Tylenol, some Excedrin, and anything like that that is CVS brand. And then they have Peer Fit. They are encouraging you to work out. And what they do is they give you like discounts, and they give you points so that you can try different gyms or different type of classes. So maybe you want to try one type of gym, and then you can try another. You can try yoga. You can try different types of classes. There's no charge again for this program. You can click the peerfit.com/Aetna and use that to work out and see if there's some of these classes and maybe one of them you really like, and you can continue it moving forward. And then that is it for me. So is there any questions? I know I kind of went through a lot before I dive into the website.
I have a quick question. In regards to the program that you were mentioning at the end, currently I have like $100 on that app because I'm using it. What happens to that and how can I use it before my insurance expires?
For the gap, you mean?
No, I have the app for, let me see, UHC Motion, and I have like $100 there. It's basically the fitness app that you were talking about for.
The motion is different than this peer fit. I don't think that like, I think it's use it or lose it. What you can try to do is see if you can transfer it, because within motion you can transfer it for other things. Maybe if you've accumulated $100, maybe you can get it in gift cards, or maybe a fitness like a Fitbit. I don't know if you have enough for an Apple Watch, but maybe you can transfer that to something else within motion, because motion has a lot of different parts.
Okay. All right. Thanks.
If you want, you can call us after, and maybe when you have it open, we can try to see if there's a way, but definitely you're going to want to do that within the next month, because as of December 1st, you'll lose whatever you have in there. It's not transferable. Since it's kind of it's just an added benefit for having United. Just like now that we're moving to Aetna, it's an added benefit with Aetna. So it's something that you can take with you. So let's kind of look at that and see if you can transfer it to gift cards or like a Fitbit and use it, because it's better than losing it.
Okay. Thanks.
Okay, no problem. So after this meeting, everyone's going to receive an email. And when you go ahead and register, it's going to look like this. Again, you have your document library with everything detailed that we've talked about. You're going to have all of the quick links. So if you want to look up an Aetna provider or a UHC dental provider, you're going to have all the quick links to all the different portals, also our website. So if you want to reach out to us, and that's the easiest way that you want to reach us, that's going to be at your fingertips. But you're just going to go ahead and hit start enrollment and get started. And we've pre-populated everything since you guys were in there last year. But if something changed, just quickly go through it. And if something changed, just go ahead and update it and hit save and continue. Really important that your address is up to date, because if it's not, you're not going to get your new Aetna card, and it's important. So just put this. So you're going to want to update it. If you're thinking about adding any dependents, even if it's just on the dental, let's say that you have your kids and they want braces and you just want to add them on the dental, please add them here. Because if you don't add them here, you won't see it won't give you the capabilities of adding your dependent for dental. Okay, so make sure you add any dependents that you're thinking of adding. You don't even need to add them at the end, but it's going to give you the opportunity to see the cost and enroll them. Then you're going to hit save and continue. This is the medical. So you have the EPO, the national HMO, that's at no cost, that you can select it, or you can take the PPO at $5. And then of course, if you have dependents listed, you'll be able to check mark right up here what that dependent is, and it'll come up with a cost. So I'm gonna select the free one. I'm gonna save and continue. And if for whatever reason you forgot what I went through, and you have questions, we link the benefit summary right here for you. So anything that you need, it's going to be kind of toward the right-hand side, and of course in the library. It's going to ask you for a primary. Just go ahead and put one on there. It's not going to show up on your card with Aetna, but we like to have it on file. Then you're going to have the gap. So you're going to automatically be enrolled, because obviously it's no charge, but if you wanted to add a dependent, you would do it here. So let's select. If for any reason you wanted to waive coverage on anything, you would just hit don't want this benefit. Then you have your dental. Just going to hit select because it's no charge. And then you have your vision. You're going to hit select, save and continue. And then this is super important, the life policy. It's going to automatically be enrolled. However, it's not going to let you move forward. It's not going to let you finish unless you add a beneficiary. So really important. You might have one from last year, but just take a look and put that person in there. So you can put, again, a spouse, a friend, as long as they're over the age of 18. You're going to say how much you want to allocate, because maybe you want to have 2 beneficiaries and you want to give 50% to one and 50% to the other. Just always make sure it equals 100% of the 25,000. You're going to want to put the name of the dependent. And if you have more of their information, great, but we really just need a phone number and a name. But if you have their address and their dates of birth, just put as much information as you have. You're gonna save it. You can put a contingent, so if something happens to your primary beneficiary, it goes to your contingent, and then save and continue. This is that United's gone paperless, so it's a notification that they've gone paperless. If you still want mail, you can just hit disregard. And then that's it. So it's gonna give you, before you hit click to sign, just review. It's gonna give you a overview of everything that you chose. Just take a look at it. It's gonna tell you your total deduction per pay period, and just make sure everything is exactly the way that you wanted it. And then all you do is click to sign, and you are done. And you'll be able to you won't be able to continue to change your elections, right? Once you do it, but you will be able to always access these benefit summaries and these apps and everything else right on here. So that is it for me. Any questions?
No questions, but I do want to add, I want everybody to understand that even if you choose not to elect any benefits, you like the benefits of your spouse, it's also covered 100% for your spouse, and you want to go on theirs, everybody must complete the waiver form. So if you choose not to get any benefits, still sign up, still sign in, click through everything, and make sure you waive all the coverage that you don't want. Also, 7 days we have from today to next week Friday to get all your questions answered, to make decisions, to make your choices, to make your elections. By next week Friday, we need to make sure everybody's applications are completed, filled out. If you don't see the email that Crystal was mentioning by Monday, get with me. I'll make sure that everything is set up correctly on our end, that nothing got lost in spam or there's a wrong email or anything along those lines. For most of you, it's going to go to your Alliance email. Some of you did choose your personal email, so just check both places before you reach out to me that you didn't miss one of the email addresses that you have on file. And any questions, reach out to me. You can reach out to Jessica or Crystal over at FD National between now and next week Friday.
Yeah, please reach out to us. We're happy to help. We want to make this as easy and smooth as possible for the transition. Jessica will be back Monday, so again, you can reach out to her, to myself. I'm happy to help. We all are here to make this as smooth as possible. And like mentioned, it sometimes does go to spam, so check your spam as well. And then if not, just reach out and we're happy to make sure you receive that.
Crystal, just wanted to say thank you very much for filling in, and just a big shout out to you and Golan for working together to get us an amazing plan. We are thrilled to be able to offer something so great to our team, and couldn't have done it without you guys working together to bring it to us.
Thank you. I'm so happy to be able to do that for you. And we definitely didn't want to move the meeting, so I'm sorry, but anything that you need or any questions, me and Jessica, we work hand in hand. So anything that you need, you're happy. You can even text me if somebody has something urgent that you need today too. All right. Well, I hope everyone has a great afternoon and a great Friday. And
thank you.
We'll be in touch soon again.
And then, Chris, you're going to email me the video, right? The link for the Zoom?
I'm gonna email it to you. Yeah, it's going to take me a few minutes to download it. And as soon as it's downloaded, I'll send it right over to you.
Thank you.
No, you're welcome. Have a great day.
Have a good day. Bye-bye.
Thank you. Bye.
Thank you.
Bye.